Hello, this is the chapter 14 review for the final, and I'll talk about some things to remember for the final real briefly. But if you use the study guide for the final and you go through all the chapters and all your PowerPoints, you should be okay. Most of the questions are going to be very, very familiar. There may be a couple that are new, so don't just rely on the questions that you had before. So, birth defects, they're present at birth. They're called congenital malformations. So if somebody has a congenital medical diagnosis, then it means that they were born with it. They didn't develop it later on in life. And it's a result of multiple factors. It could be the environment, it could be health issues with the mother, it could be uh, related to smoking or drug use. There's so many different things that it could cause, and it's usually not one thing. Hydrocephalus, this is when they have water on the brain. That's like the literal translation. So, characterized by increase in cerebral spinal fluid within the ventricles of the brain. So, the fluid in the ventricles is supposed to come in and out, it's supposed to be absorbed. Sometimes it doesn't happen. Sometimes it doesn't get absorbed, or sometimes it's blocked and it can't flow out. So, there's two different ways that that could be causing it. And that's the difference between communicating and non-communicating, whether it's being absorbed or whether it's flowing out or not. And this results in imbalance between the production and absorption, and there's increased size in the head, and there's pressure on the brain because there's just too much fluid and it can't be absorbed, it can't flow out, so it's trapped. So increase in head size. Cranial sutures separate to accommodate the growing head. The scalp is really shiny because it's really taut and pulled tight, and the veins are dilated. So here's that image that we saw before. So symptoms, they're going to have increased blood pressure, decreased pulse and respiration, and a high-pitched cry. So if you've noticed, high-pitched cry can be seen in hypoglycemia, it can be seen in other issues. So it's kind of like their way of saying I'm in pain. No, it's not a I'm hungry cry or I'm poopy cry or I'm bored cry. That high pitched cry is a pain cry. So high pitched cry may have unequal pupils, bulging fontanelles, and they could be irritable or lethargic, and they might not be feeding well. Spina bifida. So occulta is the one that is not as severe. It's a minor variation of the disorder. There's a very small opening. There is no protrusion or sac or anything that appears outside of the skin. But they may have that tuft of hair, dimple, but they don't have any nervous tissue that's actually bulging out. Treatment is not usually needed. They could have gait issues, and sometimes they need corrective surgery for their feet, and they could have disturbances in bowel and bladder, so they could not have control of bowel and bladder, and sometimes they have to have a catheter. So, spina bifida cystica. So this is the one. It's a cyst. There's a sac outside of the skin that should not be there. So a meningocele, this contains portions of the membranes and CSF. The meningeomyelocele, this is more serious. This is a protrusion of membranes and the spinal cord. So part of the spinal cord is actually bulging out. They often have paralysis, poor or no control of bowel or bladder function, and they can have hydrocephalus. This is the nursing intervention here is to protect that sac from infection until surgery. So cystica is a cyst that's on the outside. And the occulta, this is where there's nothing on the outside and it's a minor variation. So cystica is the worst one. And then meningomyelocele, that one's the worst of those. So this protrusion, this is what you need to think of. Cleft lip. It's characterized by a fissure or like a crack or opening in the upper lip. The maxillary and medial nasal processes do not fuse. It's more often seen in boys than girls. So this is a cleft lip right here. And they can have, it can be bilateral. This one's just on the right side. So this is a little bit more severe. And then this is actually going into the palate, so you can see the difference. So these are cleft lips. This is cleft lip, but this is also cleft palate. So C and D are definitely cleft palate. Treatment, it's called the cheiloplasty. They do the repair by 3 months. And here's a couple famous people that have cleft lips. So you need to prevent them from sucking and crying. That's really hard to do with the infant. So they may get a medicine dropper or like a syringe to feed until it's healed. So this is actually what a kind of a special syringe. It kind of just slowly lets the milk in instead of them having to suck on it. So here's the cleft palate again. The hard palates do not fuse. And this all occurs in like that during that organogenesis, that early part of development. So somewhere 2 or 3 weeks of 10 weeks gestation, that really important phase in fetal development. And they're at increased risk for respiratory tract and middle ear infections. So club foot, it looks just like a golf club. The foot turns inward or outward. And this Talipes equinovarus is the most common type. That's when it turns inward. So varus means inward and valgum means outward. And you might see that in orthopedics if you're looking at like bow-legged, or you're looking at whether a leg turns in or outward. When you rotate a leg outward, that's vargum, and when you vargus, and when you roll it out. Anyway, so the most common one is the inward, but it can be both. So make sure you kind of know that word. Conservative treatment, splinting or casting. Hold that foot in the right position. Sometimes that's all it takes. Passive stretching exercises. So this is just like that passive range of motion. If not effective after 3 months, then they go to surgery. So developmental hip dysplasia, DHD. So you're gonna have the clicking or the abnormal hip with movement, but you're also gonna have uneven gluteal folds, and then the knees could be different heights. So here's actually an X-ray. You can see like this is the femoral head, and see it didn't grow right. So the head of the femur is partly or completely displaced. This is more common in girls, more apparent as they start to walk, but they do get checked at pediatric visits. I believe up until about 12 or 18 months, they should get checked. So when people say they have a hip fracture, they're really talking about a proximal femur fracture. So this is the femur right here. So when they say a hip fracture, this is your leg bone. They're really talking about this. Most fractures occur in this area right here. Just a little. When you have a pelvic fracture, it's actually the pelvic bone. But most of the time when people say they have a hip fracture, it's really their femur. So these are the two tests. You don't need to know these, but Barlow and Ortolani, those are in and out, abnormal clicks. So the treatment, constant flexion and abduction for 1 or 2 months. They want to keep the head of the femur within that socket. That's going to try to enlarge the acetabulum. The acetabulum is like the ice cream scoop bone on the pelvis that the acetabulum, the round part of the femur, goes into. So they use a Pavlik harness, and surgical intervention may be necessary. A little Pavlik harness. So PKU diagnostics. So this is done 48 to 72 hours after birth, preferably after the infant has ingested some proteins. Many states require this test to be performed prior to discharge, and in some states, they require this test to be done again 2 weeks after birth, but I don't think Connecticut has one. Down syndrome. So this is the most common chromosomal abnormality. There is a higher incidence or rate after 35 years for women and fathers when they're over 55. Infant has mild to severe mental retardation, and some physical abnormalities are also seen. And there's a wide variation in this. So there's 3 phenotypes. This is how a phenotype is how their appearances. A genotype is what the genetics are. But there's the trisomy 21. This is the most common. So there's that third number 21 chromosome instead of 2. And there's a mosaic. This occurs when both normal and abnormal cells are present. Tends to be less severely affected in appearance and intelligence. And then translocation of chromosome. This is where a piece of 21 breaks away and attaches itself to another chromosome. So trisomy 21 is the most common. So you see how the outer canthus of the eyes should match up with the ears. They have this palmar crease. You may hear people refer to this as it's a different term. It's an old term that's really simian crease. That's really politically incorrect. Do not call that a simian crease. That's referring to monkeys, I think. But it's a very old school term, and you may still hear nurses say that, but it's a palmar crease. So erythroblastosis fetalis. This is basically when you have the Rh incompatibility and things go bad. So indirect Coombs test will indicate previous exposure to Rh positive antigens. Remember, antigens are things that come into your body. Antibodies are what your body makes. Antigens are injected or put into your body. So RhoGAM, RHD immune globin. We always call it RhoGAM. Nobody calls it the long word. Anyway, it's administered 72 hours after delivery. I think you all know that. If the mom is Rh negative and the infant was Rh positive. If there's an ectopic pregnancy and after abortion, and sometimes after amniocentesis. May be given to the pregnant woman at 28 weeks gestation also. We know that. Connectorus bilirubin has reached toxic levels. Accumulated bilirubin in the brain tissue can cause serious brain damage and permanent disability. Infants will have jaundice along with irritability. They're going to be tired. They're not going to feed well. Oh my gosh, high-pitched cry. So high-pitched cry when there's something wrong. That's that different type of cry that infants have. Muscle weakness progresses to opisthoton. I don't even know what that is. I'd have to look that up. Seizures. So seizures, brain, high-pitched cry. So there's an accumulation of too much bilirubin in the brain. Kernicterus. Jaundice that occurs on the first day of life is always pathological and requires prompt intervention. So you want to assess the skin, the sclera, the white parts of the eye, and you might see that yellow or orange cast, and it could be very subtle. So I just wanted to talk about your med cards that you had this week. I know you had the lactulose. So when people have liver disease and they have a buildup, their liver doesn't get rid of ammonia levels like it should. So their ammonia level builds up and it gets too high. And then it goes to the brain and it causes problems. So they give them lactulose to have them poop out the excess ammonia. It helps clear the body of that high ammonia level. And if you see somebody with liver failure or liver disease and they have that liver flap, that ataxia, where their hands are flapping, that's usually indicates that their ammonia levels are too high and they need that lactulose. But I just wanted to share that. We talked about that at clinical yesterday, and I wanted to make sure everybody knew that lactulose is to get rid of that excess ammonia level, and it's going to cause problems in the brain. So it's very similar to the bilirubin causing problems in the brain, which is kernicterus. Okay, intracranial hemorrhage. Most common type of birth injury may result from trauma. There may be anoxia, which is no oxygen, more often in preterms. Unprecipitate delivery. Make sure you know that that is 3 hours or less, and they are at risk for injuries to the mom. So there could be like higher third, fourth degree tears, and also the mom's at risk for postpartum hemorrhage. So infants of diabetic mothers. Large amounts of glucose are transferred to the fetus, causes the fetus to become hyperglycemic. Fetal pancreas produces large amount of fetal insulin. This leads to too much insulin, along with excess production of protein and fatty acids, results in a large for gestational age baby that's macrosomic, like 9 pounds, over 4,000 grams. After delivery, infant may have low glucose level and a cushingoid appearance or look healthy. So if you probably haven't studied endocrine yet, but there's Cushing's syndrome and there's Addison disease. And those are two adrenal abnormalities. So in Cushing's syndrome or Cushing's disease, they have too much steroid. So sometimes if people are on long-term steroids, they may have that Cushing's syndrome, but it's not a permanent thing. So if there's somebody who's been on steroids for a long time and they have moon face, that's one of the Cushingoid appearance. There's things that happen when your heart rate goes up, your blood pressure goes up. So when you have Addison's disease, you need to add hormones. People with Addison's disease do not have enough hormone. So the adrenal glands are above the kidney, and I kind of showed you that diagram in class where in the middle of the adrenal gland, there's a heart. So that's the blood pressure and heart rate. So those things affect that. So Cushing's, too much hormone. Addison, you need to add hormone. So you'll learn about that in endocrine, and I think that's in MedSearch 4. But just wanted to explain what cushingoid appearance was. So they may have developmental defects and suffer from complications of respiratory distress syndrome. So they're more likely to have respiratory illnesses when they're first born. So you need to be extra careful about who they're around, hand washing. Most infants get pertussis and other respiratory diseases from family members or caregivers who lost their immunity specifically to pertussis. They think that pertussis immunity wears off. So you have to be careful if grandma's coming around. You know, anybody that's going to be around your newborn, you should have them get the pertussis, the DTaP booster. And that's why pregnant women have a DTaP immunization every single pregnancy. So that's tetanus, diphtheria, and pertussis, where adults normally would get just the tetanus and diphtheria every 10 years. A little side note, if you have a deep puncture or a dirty wound and it's been 5 years, you get that tetanus vaccine again. So they may have low blood sugar, hypocalcemia, low calcium, and hyperbilirubinemia. So they're going to have low blood sugar, low calcium, and elevated bilirubin. So remember what that leads to. You're going to monitor their glucose levels, vital signs, look for irritability. You're going to look for tremors. They're going to be hangry and low sugar. They're going to shake. You're going to look for respiratory distress. And that should be less than 40. Glucose levels less than 40 can result in rapid and permanent brain damage. So a glucose of 40 is normal, but less than 40 is abnormal. That's it. So for stuff from the final, make sure you go back and remember who Semmelweis was and what he discovered. Make sure you know the basics about pain, tolerance, threshold. Know a little bit about the first week or two of gestation, what's happening in the body. Know a little bit about the contractions, the definitions that go there. Definitely know normal vitals. Pretty much just review your PowerPoints and the chapters. There aren't any medications on the final. There's just a few math questions. There are 50 questions on the final because this is a short class. It's under a certain number of hours. So there's only 50 questions on the final, and there are 3 bonus questions. So make sure you study. And I did send, I found an ATI review on Quizlet. It's 150 questions, and they appear to be right from the ATI. So go onto my Quizlet account. It's Tamie, TAMIE _ JV _ RN, and look for it's called maternal newborn review questions or something like that. It doesn't say ATI in it, but those are right from the ATI. So you can study those if you want. All right. I will see you all on Tuesday.